Hey, welcome back. And have you ever considered breast implants? If so, well, how do you know if you're a good candidate? Dr. Ronald Schuster, Chief of Plastic Surgery at Northwest Hospital Center, is here with us today to discuss an ideal kind of breast implant. So welcome, Dr. Schuster.
Good morning.
I know we were talking about this during the commercial break and everything, and just getting an idea of what the ideal implant is and what makes it different. So let's talk about that. Let's hold this up and show everybody.
Sure.
So this is the ideal.
This is it's called the Ideal Implant. It's a new design. It's a new company of a new type of breast implants.
Okay.
It's designed to give the implant a very natural breast-like feel.
Okay.
With the safety patterns of a typical saline implant. It's filled with saline, and it avoids the issues with silicone gel, which is primarily what is used today.
And so, obviously, this is new technology. We started out, am I correct, with the silicone?
Yes, the silicone gel and saline implants have been around for decades, and there hasn't really been any change in the design until recently, until the new Ideal Implant. And the majority of women choose to use the silicone gel implant because it gives the most natural feel.
Okay.
But it has issues, and as we know, nothing lasts forever.
That's correct.
And so whether it's a heart valve, a knee replacement, a breast implant, it's going to wear out. So when it does wear out, what does that mean for the women? For the woman that has the implant.
Right, and it could cause some problems if it's with silicone and not
Correct,
saline.
It doesn't just dissolve.
Right.
With the saline implants, when these wear out, it just dissolves in the body, and the woman knows about it. It doesn't make them sick. With the silicone gel implant, it stays inside the body, and so we call that a silent rupture, because the woman probably will not know about it.
Okay.
So with the new Ideal implant, it behaves like a silicone gel implant, but when it does wear out, the woman knows about it right away. So it gives her a peace of mind. She knows what's happening with the implant. She doesn't have to worry about getting an MRI to find out about it.
So with the new technology, again, you were calling this the Ideal. The shape of it, too, is one of the first things that I noticed.
Yes.
The shape compared to some of the other previous implants. How important is this? I mean, what is your feedback been so far about the shape of it? You know, women liking that?
Yes, women love the shape. It's because it's shaped very similar to the others. It does have some advantages over the traditional saline implant because...
Yeah, show them that, because we were talking about that earlier.
So with the traditional saline implant, you can see that as you stand more upright, there can be some what we call collapse of the upper portion of the implant.
Okay.
And also down below, there can be this rippling, what we call rippling. And sometimes you can feel that in a thin woman.
Right.
When side by side, hopefully you can see, that the Ideal implant solves those problems because of the way it's constructed.
And I was telling you, they need to make plastic, they need to make potato chips bags like this, and I would never get into it. Okay, so this is sturdier, and Ideal is ready for anybody, right? Anybody
yes,
can
any woman who's interested in enhancing their breast is a candidate.
And the sizes, they go from A to D?
They're sized a little bit differently. Yeah, in volume, and there's plenty of sizes to accommodate the woman's desires and between the woman and her surgeon. Yeah.
So the FDA, I want to make sure I'm reading this correctly, says silicone gel implants are safe, so why are women concerned about that silent rupture? Yeah,
the concern is a woman would have something in their body they just don't know the integrity, whether it's working, whether it's broken or not.
Okay.
And then what need to do about it. Silicone gel implants are safe, but there are these issues, and it's been recommended that women actually have MRIs every other year to find out if the implants are intact. But most doctors are not really complying with that, or patients getting it because they feel like the safety factors is fine. But really, the rupture rate is fairly high with the typical silicone gel implants, and that's why.
And how often do you need new implants, or? I don't know if you would say new, but, you know.
To have them replaced. Yeah. You only really need to replace them if they break. So with the silicone gel implants, it really ranges between 10 and 25% over 10 years. So that's, it's significant, though. With the saline implants, it's a lower rupture rate, and again, the woman knows about it right away. She doesn't have to worry about getting additional tests. Absolutely. All right, Dr. Schuster, thank you. Good information. Thank you very much. New technology for the Ideal implant. Okay, and where do we find you for more information? You can reach me on my website, cosmeticsurgerybaltimore.com. Okay. Yeah. Thank you for joining us today. We appreciate it.